Welcome to Module 4. In the last module, we talked a little bit about some of those underlying issues or situations that can predispose a child or an adult with developmental disabilities to displaying challenging behavior. This module, we're really going to hone in on one specific situation, which is trauma. So throughout the readings for this module, you're going to be learning more about what trauma is and how it can impact children and adults. And trauma that's experienced during childhood can be particularly problematic to development. So, as adults, if we experience trauma, we have developed a series of coping techniques. We have hopefully a support system in place that help us um, deal with that trauma effectively and that prevent it from impacting us as significantly. In addition, during childhood, particularly during those very early years, the brain is undergoing rapid development. And so trauma actually impacts brain structure when it's experienced during those early years. Now, this isn't to say that many adults who experience trauma don't have significant effects from that trauma. They do. And so you will see adults who experience things like post-traumatic stress disorder because of traumatic events in their life. However, when trauma is experienced during childhood, it impacts a little bit differently because it impacts brain development. And so you will see children who have, as adults, they may or may not fit the diagnosis of PTSD, but that trauma has changed physiology, their brain chemistry, and the way their brain works, which lowers their ability to use coping skills. Now, you may again be thinking, well, you know what? This happened to me when I was a child, and I think I'm perfectly fine. And you may very well be. One of the things about trauma, like so many things, is that two children can experience the exact same traumatic event or series of traumatic events, and one child will be significantly impacted, another child will not. We call that resilience. The child who is able to experience trauma without their development being negatively impacted is said to be resilient. And we don't completely know why some children and adults are more resilient to trauma than others are. There's also kind of the opposite of that, whereas one child may experience something which most of us may not even perceive as trauma. Maybe parents gain a divorce, or maybe, a death of a pet. And we may say, well, that's not really trauma. But to some individuals, that will have the same physiological, biochemical impact that something like being physically abused or witnessing somebody being shot or having, a death of a sibling or a parent. It will have that same effect on that particular child because some individuals seem to have a lower tolerance level for trauma than others. So, what makes some children and adults more resilient to trauma and to other adverse situations that happen throughout their lives? Again, we don't completely know. Some of it seems to be genetic or biochemical, or just it's biological in nature. But we do know that having the support of a caring adult makes a huge difference in whether or not a child or an adult will be resilient. And so, for many individuals, this is a parent, this is a caregiver, but it can also be a teacher. It can be a personal supports provider. It can be a babysitter. It can be a next door neighbor or a grandparent. By being that person in the life of the individual who is currently experiencing trauma or who experienced it as a young child and is still trying to process and recover for that trauma, by being that caring person who is consistent, who has a positive relationship, who is always there, who they know they can trust to help them, you can help that individual be resilient and to recover from their trauma. So throughout this module, you're going to learn a little bit more about how trauma impacts the developing child and how that impact can linger into adulthood. So those of you who are working with adults with developmental disabilities, you may still see those impacts, even though you're working with a 20 or 30 or 40-year-old. And you're also going to learn how to support those individuals to help them be more resilient and help them to live happy, productive lives, regardless of what difficult events may be in their background.